Hey there, guys, just keeping it real. Let's keep it real. We don't need extreme mobility. If some is good, more isn't necessarily better, right? So there are performance spheres where we actually need a little bit of quickness, a little bit of tightness, a little bit of elastic energy. And so I can demonstrate that really quick. Take your hand, put it on your chest. Take your middle finger and slam it against your chest as hard as you can. That is muscular energy. Now take your finger and load it, pull back, you feel tension in that finger, and then let it snap back. That's healthy fascia. That's healthy connective tissue functioning in an elastic capacity. So when you think about how far can I reach posterior lateral with rotation without my back telling me stop, that will tell me that I'm in a healthy range of motion. And that's something that I can control. So mobility is about neurological control in a performance sphere that you can actually recover from with some level of quickness. And there's recoil in that, right? So there's a safe and effective amount of mobility and movement within the body that allows us to not only move well in a healthy way, hopefully decrease injury unless there's some traumatic event. We should be able to function in lots of ranges of motion without putting ourselves at risk. And that all starts from the center of the body. That starts from the spine, that starts from the position of the head, that starts from the position of the pelvis, and not being stuck in any ranges of motion. And doing all the things to maintain healthy tissue and the integrity of the tissue. Primarily hydration. We have to stay hydrated so that that tissue does not become vulnerable. Training brings about a lot of risk factors that cause us to get behind in hydration, and then our tissue becomes vulnerable, and then we start to create compensation patterns that put us at risk. So mobility on Mondays is about restoring healthy mobility, not creating these big crazy mobility strategies. All over YouTube you're seeing stuff and I'm like, wow, that's incredible mobility, but is it useful? And that's what we always have to ask ourselves. Is it useful in the realm that I'm trying to train for, and the world and the sphere that I want to live in, right? I want you to live in an athletic sphere where you can play pickleball if you want. Oh my heavens, I have a whole opinion about pickleball. But your ability to do what you want to do and live your life how you want to live your life is what we're after. So we're going after thoracic spine a little bit today. We're always going to work on breath. Never forgetting that the diaphragm and the pelvic floor are intimately related, and we have to address that true fact. So we need to be able to move through the pelvis, move through the rib cage, and we're going to start here with foam rolling and just gently dragging the skin around the rib cage. Today we're going to go straight down on the foam roller across the front of the body, front of the rib cage, where you might have your heart rate monitor, or if you're wearing a bra, you've got on your bra line, and we're just dragging the skin across there. And you should have glide there, glide and slide. Good. Just nice and easy. Glide and slide, moving the skin across the rib cage. Let's go the same thing on the other side. Using the foam roller, a little bit of pressure to help release anything that's a little sticky. I am super hydrated today. I took it a little bit easy yesterday. Focused on good nutrition and got a lot of good sleep and rest this weekend. So kind of ready to roll. Your tissue will have a response to that as well. It becomes less stressed. And the session that I did with my premium group yesterday really focused on the understanding of breath and the power of a 4-4 breathing pattern versus a 4-8 breathing pattern. And how that leads us into optimal, hopefully, rest and recovery. All right, through the upper back, support the neck. Oh, Nice, easy movement through that thoracic spine. Just nice and easy, toggle side to side, and good. Oof. Just that little bit of pressure sometimes on the spine just allows it to free up space between the vertebrae. All right, working through the adductors. The inner thigh muscles anchor the pelvis, right? They are an anchor. So we want to make sure that through training, we're allowing them to recover. So we're just working through the femur in thirds. First third down by the knee, middle third, and then all the way up by the pelvis. So we're down by the knee here, just working a little bit of internal rotation in the hip. Lift that foot. Take it a little bit further up, little bit of gentle pressure. Internal rotation and through the foot. Good, and then we'll go one more time, and this time we go all the way up by the pelvis and up by the pubic bone into that adductor magnus, anterior fibers. We're gonna lift that foot just a little bit and just working through the front side of adductor magnus and just give them a little bit of pressure in there to encourage hydration, recovery, and movement. Okay, nice, easy through that first third. Easy through the second, third, and I'm bracing a little bit with the upper body to ensure there's not too much load on those adductors. And then all the way up. Adductor magnus, turning forward, lifting the foot just a little bit into those anterior fibers, the front fibers of magnus. And then let's just take it down by the knee. Internal rotation. We always like to see that that's smooth. Sometimes I'm not as smooth as I could be, but that looks pretty good. Good. All right. Next thing we want to do is we're going to start on the back, and we're going to make sure that we can pelvic tilt. All right. So everybody just take that feet directly under knees, and all we're going to do is create space in the lumbar spine. And then pull pubic bone to belly button and decrease the space in the lumbar spine. So if I wanted to slide my hand under my low back, I couldn't. Drop the pubic bone, create space, lift the pubic bone towards the belly button, drop it, and I have full control there of the pelvis, which is great. And then you can toggle the pelvis. So push the right side away, and then push the left side away. My left side pelvis is a little bit more sticky, but just nice and easy. Toggling. Right side knee goes away, left side knee goes away. These little movements mobilizing SI joint. The SI joint connects right ilium to left ilium. So just nice and easy. You want to feel that nice easy mobility through the pelvis so that one hip is high and then the other hip is high, and you should be able to just toggle. Okay, let's go right foot on left knee. Keep your head neutral and just lift up. We'll just hold that gentle stretch. The ease of this stretch is what we're looking for. We want to be able to do it, but we want to be able to do it with ease. So if you're having to come here and tuck your head to get to that leg and then hopefully use a bunch of pressure to pull it back, we know that that's not easy. You should be able to just lift that foot up and let your hands come behind your hamstrings. Just nice and easy. That's when forced couples within the body. So if my hip flexor fires, this hip lets go, this hamstring lets go, and everybody's working together down in the lower body. So let's go left ankle on right knee, gentle lift. And it's not that you can do it, it's how easy is it, right? So I know that my hips are nicely working together, and we're just gonna hold into that position and come back. Other side. So some people might call this a stretch. In essence, it could be a stretch. I'm gonna call it positional awareness for the body. Just gonna lift it just a little bit. I can hold that, and then I can just make it a little bit easier on all the muscles so they can kind of relax into the position. Take a couple big breaths. Let everybody relax in the position. let the brain know that that is safe. Take some moments, take some relaxed breaths in the position. So right here, hold the position, couple nice breaths. Again, keeping it super simple. If you want to relax even more into a position, then you're going to inhale for 4, exhale for 6. Inhale for 4, exhale for 8. These extended exhales in the breathing patterns are what really can help stimulate that parasympathetic drive, that rest and digest, okay? All right, flip it on over, onto your stomach. Knees together, toes together, heels apart. And your head position is looking straight down. All right, so just nose 2 inches away from the floor. Create a little bit of space between the ribs and the hips. Reach up with that half sphere of tension. And just nice and easy, just hold the position. And let's go ahead and do some extended exhales. So we'll go in for 4, out for 6. Here we go. Not giving you any more cues. Don't worry, I got more cues coming. Knees together, toes together, heels apart. Here we go. In for 4. Out for 6. In for 4. Out for 6. Good. All right, so we want to add a decompression breath to this. The position is prone, decompression breathing position. This is from foundation training. And what we want to do now is add a little bit of tension. Will it upregulate the sympathetic drive? Maybe. Might just a little bit. But let's go ahead and keep that decompression breathing, tightness through the abdomen, where we inhale through the inhale. We pull the belly button away from the floor, and exhale, we pull the belly button away from the floor. So we're always creating a little bit of tension and length through the midsection of the body, and we're not letting the belly push into the ground. Okay, so yes, we're building up a little bit of pressure in the belly. We're creating a little more stress in the body by doing that, but we're going to do a decompression, a more of a parasympathetic breathing pattern to offset that. And let's just see how that goes. All right, so fingertips nice and strong and long. Nose to the ground. Pull the belly button away from the floor. And we're going to breathe in for 4. And then out for 6. In for 4. Out for 6. In for 4. Out for 6. 2 more of these. Good. So when you do that, you think about tensegrity. Think about lift. Think about what kind of core strength are we really after? Are we impressed by a 4-hour prone plank where you're down just a traditional plank movement? I'd be impressed by 4 hours, but I don't see the real purpose of it. What I'm looking for is people who can run up mountains or down mountains and maintain space and maintain the integrity at a low level contraction that keeps you from collapsing into your spine. That's true decompression, using the breath. So let's go ahead and go right into a kneeling founder, again from foundation training. Knees directly under the hips, feet outside of the knees, putting the hips into internal rotation, and we're gonna work into that hinge. So just a nice easy hinge, pull the ribs away from the hips, push the hips back. This immediately switches on hamstrings and glutes and activates posterior chain, the backside of the body. So just hold that nice and strong. Head is in a really nice position. Pull your chin back into your throat. And let's go that same breath pattern from a kneeling founder. If being on your knees bothers you, stand up and do the same thing in a narrow founder, okay? Here we go. We've got an anchored stance. We've got a nice hinge. Hands to the front. Activates the posterior chain. We're going in for 4, in through the nose. Out through the mouth. For 6. In for 4. Out for 6. In for 4. Out for 6. See if you can make it a little bigger. Push your hips back, elevate your hands, and push your hands forward. You're going to feel more glute activation, more hamstrings switching on. You don't need a big, strong contraction. You just need to feel it. Here we go. One more. In for 4. Out for 6. And good. All right, let's take it straight up into standing position. We're going into that frog squat, so feet outside of the knees, or feet outside of the hips and externally rotated just a little bit. Let the knees go out, hands straight down. You should be able to sit here for a bit. We're going to spend a little bit of time there with a gorilla lift, again from foundation training. So keeping the hips a little bit open. Woo! We're going to take that right hand up and away and look at it. Let this left hip follow the right hand. Let that left ankle follow the right hand. And then just bring it straight back. Okay? Following that kinetic chain. That right hip is going to go midline. Left hand way to the back. Look at it. And come right back. That's creating space on the front side of the body, starting to open up the chest. Good. Bring it back. Good, bring it back. Now, we talk about the sphere. How much mobility do I want? Do I need to go way back here just because I can? It's not useful motion for me. It's not a position that I really need to be in, right? Some people do. If you're a volleyball player, we would probably really want to be able to get way back in there and be able to load that spine in that way. Most people who are good runners, cyclists, mountain climbers, skiers, we want to be able to just play in ranges of motion that are useful. So I've got a little bit of tension in my hip because I ride a bike. I've got a little bit of tension in my hip because I run up hills. So probably not as fast as you, but I try. All right, toes out. We're going to go 10 frog squats. Knees out. 10 fingertips to the ground. It's actually 8 fingertips and 2 thumbs. 3, 4, 5, 6, 7, 8. You should feel no tension in the body. 9. We stay down there on 10. 10. Eyes up. Turn your right palm up. Now we're not going way out here. We're going straight by the ear. 1, 1. Shoulder blades gliding over the ribs. 2, 2. 3, 3, 4, 4, one more, 5, and 5, and gently come out of that. Woo! Mobility Monday. Let's get this week going. This is a huge week, you guys. It's UTMB this week. Ultra Trail Mont Blanc. Definitely take a Google search or search to find out how you can watch it online. It's going to be super exciting. Go Team Solomon. I'm thinking about everybody that's racing, sending you the best, and I hope everybody has a killer week. Thanks for joining me Monday morning.